So we're going to talk about surgical coaching, which is something we've been working on at the University of Wisconsin across specialties to try to improve this for practicing surgeons. So we'll start and just describe a little bit about what our current model of continuing medical education is and how it isn't really that great for those of us who are out in practice. And then we'll talk about what coaching is specifically, because it's a very different kind of teaching as opposed to typical apprenticeship models or mentorship models or even our medical student education. And finally, we'll try to see how we might be able to use this in the world of global surgical capacity building to improve all of our skills across the board, really. So in the United States, for those of you who may not be familiar with this, our American Board of Surgery requirements has kind of evolved over the years. And initially, back in the 70s, we started with a recertification exam every 10 years to maintain our credentials. And in 2000, the American Board of Surgery started requiring 50 hours of continuing medical education every year to maintain our certification. And now has moved to what we call continuous certification, which is every 2 years we have to take a multiple choice exam to maintain our certification. And you can do it open book, and it's designed to be a little bit more geared towards your specialty, but it's still not great for those of us who say, well, I really want to improve my skills. How is an open book test going to help me with that? Are there ways that we can learn better? So a lot of times we turn to professional societies such as this. We come to meetings and we hear talks and we want to learn about new procedures and new techniques, or how can I make something better? But really, if you guys are anything like me, you suffer from institutional limitations on how much time you can take, how much money you have for travel, and the increased demands on your time when you're home for efficiency and value. So you don't all have the luxuries, like I don't, of taking time to go to all the conferences and hear all the talks that you'd like to hear. So when we think about how do we as surgeons get better, what we're looking for is education. We know we are all lifelong learners. And quality. We want to do our jobs better every day. So what is the intersection of education and quality? That's performance. How do we make our performance as surgeons better? That's where coaching comes into play. Let's think about our athletes. Our world-class athletes and singers, they all have coaches. They have someone who helps them improve. Why don't we as surgeons have coaches? We are struggling throughout our careers to get better and better. We sort of reach a plateau of how good we are at a particular procedure and think that's as good as we're going to get. But in reality, we can continue to improve over the course of our career. So the Wisconsin Surgical Coaching Program has evolved from that. And let's talk a little bit about what coaching is specifically, because it's not mentoring, it's not apprenticeship. Coaching is, by definition, unlocking a person's potential to maximize their own performance. And it's helping them to learn rather than teaching them. It's not talking at someone. It's not having someone watch you do a procedure and then say, you got it, go. It's how can I actually help you do what you want to do better? And you provide objective and constructive feedback to help someone what works for them and what could be improved to maximize their potential. So surgical coaching comes in two flavors. Expert coaching, where the world's greatest hernia surgeon comes and works with you on how to improve your skill as a hernia surgeon. And then there's also peer coaching, where two peers of the same level work together to provide non-competitive feedback and work to get better. So I might ask my partner, hey, I'm really struggling in this thyroid surgery to take down the superior pole. It seems more of a struggle than it should be. Can you help me? Can you come watch me do this and tell me what might make it easier for me? And that works with the theory of how adults actually learn. We've all been through years and years and years of training, and we're no longer students sitting in a classroom. So adult learning really is dependent on you as the learner. You have to identify your goals and then pursue them. It has to be interactive, the content needs to be relevant, and you need a formative evaluation at the end of that. So what we've established at the University of Wisconsin is called the Wisconsin Framework, and it involves coaching, which is video-based versus live. So there are people that study surgical coaching and say you should have a live coach. You should have somebody come into the OR with you, let them meet your patient, tell them, hey, here's my coach, and I'm going to operate and they're going to help me. And patients don't love that. It doesn't instill a lot of confidence in them, I think, in their surgeon. And what's more common and what we use is video-based coaching, where you record your surgery And then after the fact, maybe a week later, meet with your coach, review the video and say, what could we do differently? Watch the video and say, oh, it looks like you're really struggling here at this point in the operation. Is there a way you could expose better? Could you utilize a trainee better? Could you talk to your staff nicer? There are a lot of non-technical skills that can be taught by this as well. And really, it covers all aspects of what anyone might want to improve upon in their daily performance. If you want to improve your technical skills, how can I expose this better? How can I better approach this type of procedure? If you want to improve your non-technical skills, how can I better communicate? How can I work with a trainee better? If you want to improve cognitive skills, so situational awareness, decision making, or even stress management, how do I deal with a case when it's not going well? How do I work with my trainee when we're knowing that we're having a complication? Coaching can actually help with all of those things. So to be an effective coach, you need a lot of things. You need communication skills, adaptability. You have to understand what your coachee, the person who has come to you and asked for help, is hoping for. You have to motivate, and you have to be respected in the field. You want somebody that's going to actually understand what you're working for. And our next level of research has a lot to do with who are the best coach and coachee pairs. Should an extrovert, like me, coach an introvert? Because that might not work so well. Should a colorectal surgeon coach an endocrine surgeon? What about a urologist coaching an endocrine surgeon? We both work around really important nerves. Maybe that's a great pairing. And we don't know yet who works best in the coaching relationship, but that's where we're headed. So the framework that we've established and the most data comes from actually work with laparoscopic inguinal hernia repairs. And this is how we essentially set this up. We had a call for nominations via our local surgical society. All the nominated surgeons were invited to serve as coaches, and they completed a formal coach training. So it's not just something somebody can come in and say, I'd like to be a coach. There is actually a structured training to do this kind of teaching. The coach was matched with a participant. They had a phone call to discuss what the goals were, and then the participant recorded a case and sent it to the coach. Then the coach reviews the video, and they have a live 1-hour face-to-face session where they talked about the surgery, how it went. Some people sent in very straightforward operations. There was less to talk about. Some people were brave enough to send in a really difficult operation or something where they had a complication. And there was a lot more for the coach to talk about with them. And then after that, the surgeons completed a 2-hour participant session. They signed up, and they went through periodic, about every 3 months, they would film an operation, send that to the coach, and then have a discussion session about what things were going well, what was improving, and where did they want to go from that. And at the end of the year, the data suggests that pretty much every surgeon noticed some improvement and felt better about whatever particular skill they were hoping to improve on. And the coaches found it a very meaningful relationship as well. Most everyone who served as a coach commented that they had learned a lot from their coachee as well. So how could we translate this into the world of global surgical outreach? Is this a means to establish sustainable, meaningful relationships with surgeons in very low resource settings or very remote settings that might work really well? And we think that this is a great possibility. This is some footage from my last trip to Kenya, which is where most of my surgical outreach work has been done. And we're trying to figure out how to best capture procedures that are not laparoscopy. Obviously, laparoscopy is fairly easy to capture because you have a video monitor. But what about a thyroidectomy? How do you capture that? So we trialed wearing GoPro cameras on our head to capture the entire operation. And it actually worked fairly well. It's not particularly comfortable, but it works. And that gives us an opportunity to film procedures that may not be able to be captured on another camera. And so our group started asking, would this be a great way for surgeons to learn? And we interviewed a collection of surgeons that I've previously worked with in the Middle East to ask them, how do you think that you learn skills? As a practicing surgeon, would you rather watch a video, have some simulation practice, watch visiting surgeons who are experts in the field, or perform those skills yourself and have an expert give you feedback as you're doing it? And as you can imagine, an overwhelming 92% of those surveyed said, you know, we'd rather do it ourselves and have an expert tell us what we're doing, good or bad, so that we can then learn how to do that. It doesn't help a lot to watch somebody do a procedure and then walk out and feel like, okay, now I have to do that by myself. So the big question comes into whether we need peer or expert coaches in this setting. Expert coaching is probably the most ideal setup for really highly technical procedures. We need to focus on the interpersonal skills of the coach. How do they relate to the person who they're coaching? And we need clearly established goals of what the coachee, the trainee, or the surgeon wants to learn from their coach. Technical skills is, as you all know, incredibly valuable in low resource settings and remote settings. Our hernia project was trialed with surgeons that are in the most rural parts of Wisconsin who have no backup or no partners, and it worked incredibly well. I think this is a tremendous opportunity to train surgeons locally in their own environments to help combat what we all call brain drain, where people go somewhere for training and then they never return to the environment that they're wanting to help and practice in. And I think that we need a tremendous amount of buy-in from our local partners. Anyone who's interested in setting up a coaching program or working with us could happily talk to me, and I'd be happy to give you more information about it. The last thing I think that's important is I think this allows individual practicing surgeons to tell us what they need. It eliminates what I'm sure most of you guys have encountered in some sort of very paternalistic approach to outreach and surgery. And it allows you to be specific in what your learning needs are. There are a lot of challenges in setting this up, for sure. The technology's not always there. We've used everything from a GoPro to an iPhone camera that somebody held and just recorded the surgery right over the surgery field. Language barriers can be a problem. Patient volume can be a problem. But I think there are a lot of opportunities for this program to grow. The benefits are really incredible. Coaching preserves your autonomy, and it allows you as a practicing surgeon to decide what it is that you want to learn and what you want to improve upon. It's constructive. It's not meant to be punitive. It's not meant to insult someone who has had a complication or maybe feels like their skills aren't there. It's designed to get you to that point that you want to be. What is your personal best as a practicing surgeon? It can address a lot more than just procedural skills, although that's probably the most useful point for it right now. And it really empowers the coachee or the learner in this setting. And so it really leads us to the question of how can I help you? As a surgical coach, I think it's something that anyone can benefit from, and we are certainly looking for. So if you think that might be of benefit to you, please let me know. And thank you guys for the opportunity to talk about our research.